Hi, today we are with Dr. Jose Mahfoud, naturopathic physician at the Ashe Faith Project. We are going to interview him and ask him a few questions. If you could please give us a brief description on the naturopathic clinic and how it operates.
Yeah, hi. The Naturopathic Clinic, community clinic here at the Ashe Faith Project in Bridgeport, Connecticut. It's a joint effort from the University of Bridgeport and Mount Airy Church through the amazing work that Reverend Nancy Kingwood has done with us. We've been working on this project for a number of years now. It is part of our curriculum for the students. As my student Anthony explained before, there are clinical hours that are needed for students to graduate as naturopaths. So part of the hours and patient contacts are completed here. This is only one of our multiple community clinics. They're all free. All community clinics are free. All costs are covered for patients, and depending on the clinic, we see a different kind of population. So here we serve the greater Bridgeport area with various types of conditions and various types of patients, but mainly primary care. You can think of it as primary care, naturopathic primary care.
So why is the clinic free?
It is free because it is part of the student training. It's part of their curriculum. It's required for them to complete a number of hours in patient contacts, and also in the School of Naturopathic Medicine at the University of Bridgeport, we always include community service as part of our philosophy. It's part of who we are, and we believe naturopathic medicine should be available to everybody, you know. So that's another way of promoting naturopathic medicine in the community, and we've had great reception for years. So people in the community in Bridgeport knows who we are, and they seek us out, and yeah.
Could you give us a few examples of how the clinic serves the community?
Well, you have it right there. It's a free naturopathic medical care. I think that does it right there. But we can see patients for a variety of ailments. Let's say, especially chronic ailments. Naturopathic medicine specializes or focuses more on treating chronic conditions like chronic pain or metabolic conditions like diabetes, for example, which it can be very complex, but at the core, it's a very simple condition. Let's say diet modification does wonders for people with type 2 diabetes, for example. And we, as naturopathic physicians, we base our care, or one of the pillars of our medicine is education, patient education. So we work with the patient to teach them how to eat, what not to eat, what to include in their diets, and that alone would make a huge difference. It is not as easy as it sounds. Diet modification for patients is pretty much the hardest thing. We all know how attached we are to the things we eat. So mainly people with type 2 diabetes are another thing, chronic pain, for example. Chronic pain is a huge problem, especially in some aging populations. And we have many techniques, many modalities that are either non-toxic, non-invasive, or more benign for patients. Even patients who are already on medication, We work around that, and we, since our students get the training, we teach them how to take into consideration any drugs that the patient, any prescription drugs that the patient might be taking, and tailor a individualized plan so as to avoid any drug interactions or drug-herb interactions. Hypertension, like high blood pressure, also we work with that as well. Three big conditions that we see a lot of patients with: insomnia, anxiety, and depression, especially in these times of pandemic. Since the pandemic hit, public health has seen a huge spike in cases of insomnia, depression, anxiety. People who never had that before. We see a lot of people coming from that. And we have a lot of ways that we can help people. We don't promise to be, the best out there, the best kind of medicine. There's no better medicine. It's a naturopathic medicine is one kind of medicine that can offer great solutions for certain people. Some people will need medication, and that's okay.
Absolutely. Well, actually, since you mentioned the pandemic and the current state of our world, we'd like to ask you a few questions about COVID-19.
Oh boy, sure.
In your opinion, why are some people reluctant to getting the COVID-19 vaccine?
Oh, a few reasons that I can think of. There might be more. Number one, I think it's fear of the unknown. This is a new type of vaccine, new disease to us, and people don't know what to expect. So people are afraid of putting this vaccine in their bodies that is made from a disease that a year ago did not exist, or almost did not exist in our society. So fear, it's understandable that people would fear what they don't know. Another one is, unfortunately, misuse of social media, which we all know. I mean, hi, social media, but it can be misused, and the amount of misinformation and fake news, right? It's alarming. So there are a lot. I don't know why. There are a lot of people who spread these misinformations. Probably they just come up with it, I guess. They come up with their own reasoning and their own justifications, and they believe those things. And they use the power of social media to reach many people, and a lot of people are very susceptible. Due to the very nature of social media and how it's engineered, it targets people and it knows who to reach, and that's another interview if you want to talk about that. But another thing is another reason would be politics. Absolutely. Unfortunately, this public health crisis, I'm going to say it again, this public health crisis has been politicized, which is, it baffles me, but that's another reason. And probably ignorance as well. Ignorance gives people the susceptibility to be swayed by these things.
Okay, so how many COVID-19 vaccines are available?
Oh, three, I believe. Approved are three. I believe the last one was approved, or is about to be. So there are three. There's the Moderna vaccine. They're based in Massachusetts. That's the one. I think that's the one most popular here in Connecticut. There's the Pfizer one, which was the first one.
Is that the refrigerated one?
Yes, the Pfizer one is the one that needs to be at sub-zero temperatures. It's it's not very stable thermally, not very stable with the heat. The Moderna is more stable. The Moderna is you can store it at normal temperatures, like refrigerated temperatures. But you don't need sub-zero temperatures like the Pfizer vaccine. Although they have very similar technology, they're made with very similar technology. And the third one is the AstraZeneca Oxford vaccine. That's different. That's different than the other two. In that the first two are very clean, so to speak, meaning that they have they take the mRNA or a part of their genetic material, a small piece of genetic material called messenger RNA, and they envelop this in a little fat globule, like a little drop of fat, so you can understand the idea. And they deliver this. There's some stabilizers, some other lipids, cholesterol, things like that. And they deliver that into the body, and then the mRNA stimulates or uses our cells to make antibodies against COVID-19. So it kind of tricks the body into believing that it's been infected. It's not infected. You will not get COVID from any of those vaccines. Okay? You will not get COVID from any of those vaccines. So then the body makes antibodies, and that offers protection. Unfortunately, we don't know how long this protection lasts, but I guess we will. The AstraZeneca, I said, is different. The AstraZeneca vaccine is different because it uses what they call a viral vector, which means that they take a common virus, an adenovirus in this case, it's a common virus that causes sore throats and pink eye and all that. So they take this virus, they do something with it, and they put in what I talked before, the mRNA, the messenger RNA from the SARS-CoV-2, which causes COVID-19, and they inject that modified virus in the body, and then it causes the body to react and produce antibodies and kind of mimic the disease, but without the symptoms of the disease again. To offer protection, but this method, there's a bit of controversy with this one. They saw some challenges while developing the vaccine, and finally, I think they are, if they're not approved, they're about to be.
Are there any heavy metals in either of the COVID-19 vaccines?
That is a great question. Heavy metals, I think I know why you asked me that. Heavy metals, that's a huge anti-vaxxer argument, that they have mercury, thimerosal, aluminum, etc. The answer is no. These vaccines do not have any mercury, any aluminum, or any other heavy metal in them. As I said, they are very clean compared to other vaccines because it's a new technology, which makes me think that people might be afraid, going back to your first question, if I may, that people might be also afraid of the vaccine because the vaccine was developed so fast compared to other, historically, right? But what people are not remembering is that the scientists who developed this, they did not start from zero. They, remember in 2003, I believe, SARS hit, the first SARS-1. COVID-19 is SARS-2 or SARS-CoV-2. So they had already done doesn't mean it's bad quality. Also, there's a lot of money into that, and money tends to speed up things, as we know. Right?
So what are some of the ingredients in the COVID-19 vaccine?
Oh, well, besides the messenger RNA or mRNA, there are some lipids or some oils or fats, right? Cholesterol, some other fat derivatives or attached to polyethylene glycol, you might see PEG. There are the Moderna, I remember it has some proprietary lipid that they don't give the actual name for, but it's just their own blend of fats. It's like a fat, like a little oil, and with special technology they make these like very, very tiny droplets. They call nanolipids, very, very. So that coats the mRNA to protect it because the genetic material of the virus is very susceptible to damage. So that protects it and delivers it. There's also sodium chloride, like saline. There's some glucose there. Things that, yeah, they have the potential to cause an immune reaction, which is what we want, but very clean compared to the other ones. They don't use eggs to make these vaccines like they do with like other vaccines, like chicken eggs, like to culture the virus. None of this is used. They don't use thimerosal or mercury. None of that.
Do you recommend that all people get the vaccine?
All people, no. I think, and this is my personal opinion, I think that the vaccine is safe for most. But people who have had reactions like adverse reactions to vaccines in the past, any type of vaccine, should not take this and should consult with their provider. They could, their primary care physician, or they could make an appointment here at Ashe with us, and we can orient them in what to do. But people who have never had allergic reactions or severe reactions to vaccines, or are not allergic to anything that may be related to the ingredients in the vaccine, should take it. I think it's perfectly safe.
So can COVID-19 be cured with vitamin C?
No, absolutely not. This is one of those myths, and unfortunately it involves a natural supplement, which kind of makes naturopathic medicine look bad. But no, it cannot be cured with vitamin C. I know people will still claim it does, but there's no evidence that it does. Does it help? Probably. It probably can help. But there's no evidence, there's no hard evidence of that either. Is it a bad thing? No. And vitamin C, regular vitamin C intake, whether through diet or through supplementation, supports a healthy immune system, which we all know will help your resistance to all pathogens or all diseases, or many diseases out there. So the healthier your immune system, the better supported your immune system is, the healthier you are, the more resistant to getting infected with pathogens. Of course, hygiene, right, hand washing, and your social distancing, masks, etc. That has proven to be the most effective weapon we have against this thing. Many of my patients have spontaneously told me that in this whole year they have not had one cold, one flu, whereas before they used to get 2 or 3 a year. So there you have it. Everybody's being cleaner and social distancing, and that works.
What is your personal opinion on some people ingesting chlorine dioxide, hydrogen peroxide, and or colloidal silver to prevent or treat COVID-19?
Try not to judge here, but I will judge. No, that should not be done. Hydrogen peroxide should not be ingested. Not even the diluted form. theoretically, I understand why they think it might work, but no, this is an oxidative therapy. All three are oxidative therapies, meaning that if you they cause the body to release oxygen, and oxygen kills bacteria, inactivates viruses, etc. But that it's not the same to do that in a test tube than to ingest it. It's not the same at all. Chlorine dioxide, that's a huge one. There's a lot of noise about this, or there was, there's still some, about this self-described scientist, I guess, from Germany, Andreas Kalker. He's not a scientist, really, but he has a book, and people, there are people behind him. There are people who actually believe in what he says, and he support the idea that chlorine dioxide, which is you can think of it as an industrial cleaner, like an industrial type of bleach kind of thing. It's pretty, it's a gas, but it can be diluted in water, etc. It's easy to make, very easy to make. Anybody can make it at home, but to ingest it and to take that and give that to your children and to prevent COVID, no, there's absolutely no evidence that it works like that, and actually there's the potential of causing harm. I mean, you drink, it would be like drinking diluted bleach. So there's no, I mean, if it were that easy, don't you think we would have some way of doing that? But no. And then you tie that in with the conspiracy theories. That's another flag session, I guess.
So it all kind of goes back to the misinformation,
yes.
social media.
Yes. Yeah. This is the age of information, but unfortunately, the misuse of social media has made this the age of misinformation. Unfortunately, and people think they know. Yes, you know a lot of things that are completely useless.
Right.
That doesn't mean you know. So yeah.
And would you take the vaccine, the COVID-19 vaccine yourself?
I already did.
Oh, you did? Wow,
yes.
okay.
Yes, yeah. So absolutely, yeah. There was no doubt about it. It's a public health issue, and I think as a physician, it's my responsibility to contribute to public health, especially our in Greater Bridgeport, or in my surroundings. Absolutely. So very proudly.